Very good afternoon. I'll be speaking on real-life clinical experience with Razumab, the Disha Eye Hospital story. Well, the shift of global healthcare from small molecules to biologics is hard to ignore, but the problem the biologics bring forth are in terms of pricing and availability of the drug. So India has a robust biosimilar platform wherein the government has ensured that there are many biosimilars that are in various stages of evolution, and amongst the ophthalmic biosimilars that are available, Razumab probably has the largest presence with more than currently 1 lakh injections in more than 750 over 750 surgeons who have used these medications. But this is, however, only the tip of the iceberg. Part of this is that because of the nocebo effect. Now, what is that? Well, biosimilars are near identical copies of the innovator biologic product and have a potential to reduce the cost of treatment by 30%. However, they face the resistance due to widely popular perception of being generic versions and the increased reporting of minor adverse events such as low-grade inflammation, which is usually overlooked in therapy involving the innovator molecule. Now, we've talked about this already, the prospective studies, and so also the retrospective studies, which showed that there is increase in vision, and there is also decrease in the visual, decrease in the central macular thickness. And this has also been published in a couple of studies with the Reenact 1 and Reenact 2 studies evaluating wet AMD and DME RVO also. And this is also a subgroup analysis of the RVO patients who did well, and there were no safety issues. Now, if we move on to the Disha Eye Hospital story, we will go a little back in time to the year 2015, when the total number of projected injections were 15,232, and this, of course, had Avastin, Lucentis, and IVTA injections. And in 2016, we had a huge set of cluster endophthalmitis with Avastin, and we received a directive from the State Health Department to stop using Avastin forthwith, and so the number came down to 6,534. Now, it has risen up slightly, but in 2019, we could only go up to 9,560 injections. Again, the bulk of injections here were with Eccentrix Lucentis, but Razumab was catching up with close to 3,000 injections. So between 2016 and 2019 June, we have used a total of 5,763 Razumab injections, and we retrospectively evaluated this data from the EMR, and we primarily looked into safety and effectiveness of the drug. So this was across all indications, and we looked at the CMT, which decreased from a mean of 486 to 266, and so also the visual acuity improved from 0.166 logmar units to 0.41 logmar units. A number of these patients received more than 1 injections, and if we look at the morbidity, 4 patients out of these 5,763 injections developed CVA, 3 developed MI, and we had 7 eyes that showed AC cells, which were self-limiting, and we used topical steroids, and they regressed over a period of a week. We also had a couple of eyes with hyphema and vitreous hemorrhage, and 20 eyes with RPE, but this was difficult to sort of call as influenced by the injection itself. What about immunogenicity? Well, Vishali ma'am has just spoken about immunogenicity, but we did not do any validated bridging ELISA method testing of these 7 eyes. The clinical significance of immunoreactivity to ranibizumab is also unclear at this present point of time, but however, we need to carefully follow up these patients. Now, I'd like to share this data also. The total number of patients seen across the 14 branches of Disha Eye hospitals between 2016 and June 2019 were 34 lakhs plus. And out of this, we actually advised anti-VEGF in 46,000 patients. How many did take? Well, only 52%. So basically, only 52% could actually afford an anti-VEGF injections, and 48% couldn't afford anti-VEGF injections, even at 12,400 rupees. We also found out that the average number of injections per patient was abominably low at 1.6 injections only. And we know that many of these diseases need more than these 1.6 injections. So basically, it is the pricing which matters. Well, we all have these kind of slides wherein the improvement is noted in various diseases, but we need to really have a holistic approach and approach these patients with whatever is there in our armamentarium. For example, this patient couldn't afford an anti-VEGF, underwent an IVTA, didn't do well, and had a biosimilar injected, and finally with some focal laser is doing good. So another CRVO who actually went in to need 11 Razumab injections and is currently stable. We looked into wet AMD also, some of them crossovers, some of them naive patients. And actually we found that these patients do actually, tend to benefit with biosimilars. So this is one such patient. For lack of time, I'll go on to conclusions. This patient has been on Razumab since 2018, and so far has received 21 in all, starting with 3 eccentrics and then followed by Razumab, and this is the current status. In fact, this is just last Tuesday. So to conclude, I think the slide, last slide. We observed an incidence of 0.14% sterile inflammation, which was self-limiting, which is comparable to what has been found with other studies with bevacizumab. No major complications in this large series, which suggests that Razumab is safe for use, and there is no evidence to suggest that Razumab, being a biosimilar, may be more immunogenic.
Is around?
However, it is important to maintain high and reproducible standards of manufacturing to sustain the high drug quality that has been established at present. Thank you.